Good, how are you? Great.
It's 2 o'clock. Prevailing 90. These runners get up early. It is 3 o'clock, and I would like to call the full board of the Muskegon County Commissioners to order. Could I please have Pastor Tim Cross with an invocation, and would everybody rise, please?
I would like to first, if you don't mind, say thank you to Commissioner Skolnick for bringing the resolution to our Men and Ladies of Honor program on Monday, and from this commission, so thank you. Father, we just come to you in the name of Jesus. You're the God of all wisdom. You're the God of all understanding. And so, Father, your word says that the beginning of wisdom and the beginning of knowledge is the fear of the Lord. To be able to understand information and things that come to us, to understand it right, it starts with the fear of God. And Father, you said one of the 7 spirits of God was the fear of the Lord. So, Father, I pray that the spirit of the fear of the Lord would be upon this commission and be upon our leaders in this community, that they would have a reverence and a respect for you and an honor for you. And in doing so, that would be a beginning place of wisdom, the ability to interpret information correctly and properly. So, Father, I thank you for granting them that wisdom. Father, I thank you as well for their service, the time that they give to this community, and how they try to help our community. And Father, we ask you to bless them with that, for that service to our community. And Father, as this meeting goes on and the decisions that are made, we thank you for that wisdom being given to them. In Jesus' name, amen.
Amen. Thank you. Pastor Cross.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Madam Clerk, could we have a roll call, please?
Vice Chair Foster.
Here.
Commissioner Hobie Wright.
Here.
Chairman Hughes.
Here.
Commissioner Layering.
Here.
Commissioner Mahoney.
Here.
Commissioner Nash.
Here.
Commissioner Skolnick.
Here.
Commissioner Steyer.
Here.
Commissioner Wilkins.
Here.
9 present.
Thank you very much, and we do have a quorum. Next on our agenda is approval of the agenda.
So moved. Support.
Motion and support. Is there any questions, comments, or concerns? Seeing none, all those in favor, aye.
Aye.
Opposed, the same. That motion is carried. Next, we have approval of the minutes of May 14th, 2019.
So moved. Second.
We have a motion and support. Are there any questions or corrections on the minutes? Seeing none, all those in favor, aye.
Aye.
Opposed, the same. That motion is carried. Next, we have time set aside for public comment on an agenda item. Do I have anyone for public comment on an agenda item? Seeing none, we will move on to a presentation by Mr. James Kelly from our MSU Extension.
Good afternoon. Excuse my voice this afternoon. James Kelly, District Director for Michigan State University Extension. On March 1st of 1916, Ralph Olds was appointed to serve Muskegon County as the first MSU Extension County Ag Agent, and now 103 years later it's my privilege to represent MSU Extension and provide an annual report for you today to highlight our partnership with Muskegon County. The financial support that MSU Extension receives from Muskegon County provides a buy-in to the statewide organizational structure of Michigan State University Extension. and to all the programs and services they provide. This includes access to programs presented by educators housed outside of Muskegon County, but delivered to residents within Muskegon County, which would include programs ranging from food start workshops at Kitchen 242, product center counseling, master gardener presentations, soil testing, food systems education, water quality workshops, social and emotional health programming, and much more. Another example of a program that is offered as a result of your general financial support of Michigan State University Extension would be the new County Commissioner School that many of you participated in at some point. Your financial support also directly benefits the work of our local educators housed in Muskegon, such as our career and mentoring educator, Frank Cox. Frank's expertise has been utilized across the county by providing presentations to youth and adults regarding financial literacy, entrepreneurship, leadership development, and community engagement. In 2018, our health and nutrition educator, Jane Hart, led hundreds of Muskegon County residents in trainings related to ServSafe certification, cottage food laws, as well as leading sessions on disease prevention and healthy living. Your support also goes into supporting local 4-H programming, and 4-H continues to be the premier youth development program across the country, now serving over 200,000 youth in the state of Michigan and relying on the support of 16,000 adult volunteers as leaders. In Muskegon County, our 4-H program coordinator, Tanya Powell, is experiencing some excellent participation in the county and is continuing to see growth in numbers. Within 4-H, we also have a part-time staff person who's delivering STEM, science, technology, engineering, and mathematics-based programming, and youth mentoring opportunities through a program called Tech Wizards. We also have an extremely effective health and nutrition team comprised of Julie Weinberg and Carla Murphy, who provide programming to both youth and adults regarding healthy eating and healthy life habits. So to expand a little bit on the finer details, I have left some information with you today, and understand, knowing that you have a lot of discussion today, that I'm going to encourage you, of course, to review that at your own pace through the course of the next few days. I will just highlight a few of the numbers and explain what I have left with you. Firstly, you have a larger print piece, which is our annual legislative report, which comes out around October, November each year, highlighting what the MSU Extension and the Ag Bio Research Center does. So there is a lot of excellent data in here talking about impact that our programs are having across the state of Michigan. So I believe you will enjoy reading through that piece. You also have a localized Muskegon County newsletter, which has some specific Muskegon County numbers and stories for your reference. Again, just highlighting over 4,000 Muskegon County adults and youth participated in our programs in 2018. 826 youth and adults participated in health and nutrition programs. The economic impact in Muskegon County alone through Michigan State University's presence is estimated to be over $6 million. So again, please take some time to read through those local reports, local stories. If you have questions, do reach out to me. We recently also put together a list of Muskegon County programs and services. As I am new to this position, I was surprised that we didn't have something specifically to hand out to highlight what we offer in this area. So if you read through this handout and see programs of interest, have some interest in seeing those initiated within the county, you can connect with our local office or let me know, and certainly we would look to provide those services. Finally, I would like to recognize Scott Laring for serving on our District Extension Council, and Kathy Moore, and certainly recognize the support that we receive as tenants within the County Public Health Building, and appreciate the partnership and support locally that we've received. Again, on behalf of Michigan State University Extension, we appreciate the ongoing support that's been in place for over 100 years now, and I don't know if there's an opportunity for questions, let me know. Otherwise, you know how to reach me.
Does anybody have any questions for Mr. Kelly? Seeing none, I think we're good.
Very good. Thank you.
Thank you very much. We will move on to committee and board reports, community development and strategic planning.
Thank you, Madam Chair. The Community Development and Strategic Planning Committee met on May 21st. It was recommended, and I move CDS-SP 1905-10-11 and -12.
Second.
A motion and support. Any comments, questions, or concerns? Seeing none, Madam Clerk, could I have a roll call, please?
Commissioner Huntley Wright.
Yes.
Commissioner Laring.
Yes.
Commissioner Mahoney.
Yes.
Commissioner Nash.
Yes.
Commissioner Skolnick.
Yes.
Commissioner Snyder.
Yes.
Commissioner Wilkins.
Yes.
Vice Chair Foster.
Yes.
Chairman Hughes.
Yes,
9 yes.
and that motion carries.
Thank you, Madam Chair. That'll conclude my report.
Thank you, Commissioner Nash. And we will move on to the Transportation Committee. Commissioner Wilkins.
Thank you, Madam Chair. The Transportation Committee met on May 21st, 2019. It was recommended and I moved TR 1905-16 and TR 1905-17.
Second.
We have a motion and a second. Are there any comments, questions, or concerns on this? Seeing none, Madam Clerk, could I have a roll call?
Commissioner Laring.
Yes.
Commissioner Mahoney.
Yes.
Commissioner Nash.
Yes.
Commissioner Skolnick.
Yes.
Commissioner Snyder.
Yes.
Commissioner Wilkins.
Yes.
Vice Chair Foster.
Yes.
Commissioner Hovey Wright.
Yes.
Chairman Hughes.
Yes,
9 yes.
and that motion also carries.
That completes my report.
Thank you, Commissioner Wilkins. We will move on to the Ways and Means Committee. Commissioner Skolnick.
Thank you, Madam Chair. The Ways and Means Committee met on May 21st, 2018. It was recommended, and I move WM 19/05-55, 56, 57, 58, 59, 60, 61, 62, and 63.
Second.
We have a motion and a second. Are there any comments, questions, or concerns? Seeing none, Madam Clerk, could we have a roll call, please?
Commissioner Mahoney.
Yes.
Commissioner Nash.
Yes.
Commissioner Skolnick.
Yes.
Commissioner Snyder.
Yes.
Commissioner Wilkins.
Yes.
Vice Chair Foster.
Yes.
Commissioner Hovey Wright.
Yes.
Commissioner Laring.
Yes.
Chairman Hughes.
Yes,
9 yes.
and that motion is carried.
That completes my report, Madam Chair.
Thank you, Commissioner Skolnick. Now we will move on to the Chairman's report. I just wanted to let you know that the Fruitport Old Fashioned Days started yesterday, and that will run through Monday, the 27th. And their parade will be at 2 p.m. on Memorial Day. And if you've got kids, I highly recommend that you go to that. It is just an absolute fun time. The USS Clipper opens for the season today, and it is open from 11 a.m. to 5 p.m. The Summer Luge opens for the season this coming Saturday, and that includes the whole winter sports complex. And they do have a lot of things that happen out there that have nothing to do with winter. So please stop out there and see what's going on. I guarantee you'll enjoy that. The Western Market Chalets are now open Wednesday, Thursday, Friday, and Saturday. And I noticed there are some new ones as well as some old favorites down there, so that'd be a nice place to stop. On Sunday, there is the Lost Boat Ceremony at the USS Silversides, the Parade of Boats and Blessing of the Boats. The Lost Boat Ceremony starts at 11 o'clock in the morning. The Parade of Boats starts at 12:45, and the Blessing of the Boats is at 1:30. I would like to remind you that the roads in Lakeside leave a little bit to be desired, like one side of them is gone. So I would say plan a little early, and I'm hoping that it will be a little better because I'm expecting the big equipment won't be rolling through there, but it's still a little difficult to get through.
They are rerouting the parade,
Yeah.
however.
Are they good? Also, the Veterans Final Approach Memorial Ceremony will be Monday, the 27th at 2 p.m., and that's at Hayden Cove Park in Norton Shores. There's a Memorial Day Parade downtown at 9 a.m. on Memorial Day. The Lakeside Memorial Day Parade is from Denmark to Harrison to McCracken. And the Ravenna Parade is at 9 o'clock on Memorial Day, and the White Lake Parade is at 10 o'clock. And if any of you think you can do all of those, I want to report on that, because that's going to be quite a challenge. The administrator and the assistant administrator are at a conference, so they are not here. There will not be an administrator's report. Now we'll move on to old business. Is there any old business to come before this committee today?
Yes, I'd like to make a motion. I'd like to make a motion that we remove all prevailing wage and Davis-Bacon language from the Muskegon County purchasing and procurement process.
Second.
We have a motion and a second. Is there any comments, questions, or concerns on this? Commissioner?
My concern is
Uh-huh.
that this is not on our agenda at all, so that the folks who may be interested in dealing with this will not have an opportunity to speak to us about it.
And I understand that, but that does not preclude it from being on the agenda.
I understand that, but with this significant change, I think everyone needs to have an opportunity to speak to it.
Anyone else like to speak? Commissioner Nash?
I'll agree with Commissioner Mahoney. I think that, before these motions are just thrown at us and we make a quick vote, there should be some discussion about this amongst the commissioners so we can have some thorough discussion and make a sound decision. That's what I've been told over the years from this board, time and time again. So I don't understand why the change.
I get, Commissioner, I'll be ready.
Yes, given that Mr. Laring has not declared a conflict of interest with Triton, who he has said in public that they want to bid on certain projects, I think he should declare the conflict of interest.
I did have some concerns about that too. In talking with our corporate counsel, I was advised that unless the contract involves Triton Construction Company and Muskegon County, that there's not a conflict of interest.
Madam Chair.
Yes, Commissioner Wilkins.
I agree with Commissioner Nash. I think I wanted to discuss this further too. I think this should be delayed and we should bring it up later and discuss it and get all of this.
I move to postpone this.
I disagree.
I need a second.
Support.
And we have a motion in support.
You can discuss the motion to postpone, or you can just call for the vote. I would do it by roll call.
Okay. Is there any discussion on the motion to postpone? Commissioner Larry?
So I think we've had plenty of conversations. We've heard from corporate counsel. We know about a pending lawsuit against the county for this. We've had a work session where both parties were represented. I believe there's been ample opportunity. There is litigation against the county. If we don't do it, I suggest that we pursue this.
No.
Let him
So
finish.
we've had conversations, we've had work sessions that were open to the public. It's been attended openly by both parties. So we've had our work session, we've had closed session, we've had information passed to us from ABC about the pending lawsuit, and that's still on the table. I think we need to move to get this over with before we incur some financial judgments. So I recommend that we speedily remove this from our purchase and procurement process.
I think I'd like to go around the room and give everybody a chance to speak. Commissioner Mahoney, do you have something you'd like to add to this?
Other than we've had information, but the impact without having someone here that is directly affected by it is not fair. It just is not fair having labor here to discuss it. We have a pending lawsuit. It's not even pending. There's a threat of a lawsuit, but it's not pending. They have not filed that I'm aware of.
That's correct.
Commissioner Wilkins?
I just think that we need some discussion on this. Some unanswered questions that I have and I'm not satisfied.
Okay. Commissioner Geary? Commissioner Foster?
I have to agree with Commissioner Larry on this one. We beat this horse. We know what's behind it. This is for the residents. We need to save their money. That's what we're here for.
Amen.
Ooh.
No, costing them money.
Thank you. Commissioner Slater?
Well, I tend to agree, and not tend, I do agree that we should just get this over with. Of the 27 municipalities in the county is the only one that has prevailing wage in their purchasing policies. Not a single city, no, it's nobody. And of all the counties in the state, most, not all, but most have eliminated prevailing wage. It's just, to me, it's just an antiquated leftover policy, and it's time for it to go.
Commissioner Nash? Commissioner Snyder?
I disagree. We had a labor work session. We had a work session. We've heard from labor extensively at that work session. We've had an opinion of council. We are the minority in terms of the prevailing wage limitation in our policies, and I think we should get rid of it.
Commissioner Ray?
Yes, we heard from one law firm in closed session. We have not heard from the other side. There are two sides. I think we need to be educated in our in this very important decision. In terms of saving money, on the convention center, it doesn't save any taxpayer money whatsoever. A person that would pay more, if that is the case, and the labor unions would say it's insignificant, it would be the developer, John Bruck, who would just it would take longer to pay back. So it is not taxpayer money. It does not cost the taxpayers any more money. So I think we need to hear, it's rushed. We didn't know it was coming. Labor is not here to defend themselves. And I think we should not be supporting Mr. Laring's decision. I think we need more time to explore the legal ramifications and the rest.
Thank you.
Thank you.
Commissioner Snyder, any other question or comment?
Well, I'd just like to reemphasize that we had a work session on this. We sat and listened to both sides extensively for longer than 45 minutes. Both sides made their presentation. We are the minority, and I think we ought to be in a position where we are the ones that make the determination as to how much we're going to spend and where that burden is going to reside.
Thank you. Commissioner Larry?
So back to Commissioner Hoy-Wright's comment about only hearing from one side. The county heard from the side of the attorney firm that the county hired. So really, we only heard our representation. We did not. We received a letter of the intent to file a lawsuit, and then the county heard from our representation on how we should proceed. So we didn't hear from the other side. We actually heard from the county side, somebody that was legally going to represent the county.
And that firm did not represent any labor unions, and from the way it was worded, it was one-sided in my view.
Thank you. We have a motion on the floor.
I want to make a comment.
Yes, Commissioner Marsh.
And I just think that the problem that we're running into is that we're moving forward with these last-minute motions for something that's vitally important to this community. There's a difference of opinions regarding these different things, and some of us agree and some of us didn't agree. But as far as both sides being presented, if the labor hadn't been notified at the last minute that this workshop was going on, there wouldn't have been any, and this is the problem that we're having, is we keep having these surprise meetings, these surprise setups, and I think it's just unfair to, if you're gonna decide it and you're gonna devote it, fine. But have a full discussion and make sure that it's equal to everyone. But this is really not. It's partisan and it's one-sided. But if this is the way we're going to work on the board, then that's probably why this community almost sees this as a dysfunctional board now. But that's up to us.
And until everybody else has had a chance, I think we'll just call for the vote. We have a vote. We have a motion before us to postpone this decision. Madam Clerk, could I have a roll call on that, please?
Commissioner Nash?
Yes.
Commissioner Skolnick?
No.
Commissioner Snyder?
No.
Commissioner Wilkins?
Yes.
Vice Chair Foster?
No.
Commissioner Hovey-Wright?
Yes.
Commissioner Layring?
No.
Commissioner Mahoney?
Yes.
Vice Chair, let's see. Chairman Hughes.
No.
5 noes, 4 yeses.
And that motion is defeated. Now we will go back to the original motion, and that is, Mr. Lynn, would you please repeat the motion?
Motion is to remove all prevailing wage and Davis-Bacon language from the Muskegon County purchasing and procurement process.
Madam Clerk, could I have a roll call, please? Yes.
I'd like to have one comment about the Davis-Bacon. If we do a project with federal funds, we are obligated to use Davis-Bacon.
That's correct. Anything over, anything over $100,000, or I think maybe $2,000. Yes, that does not affect this at all.
Right.
Mr. Lynn?
My comment to that is, that's correct. It does not affect this process. If we receive federal monies on any projects, it's mandated that you receive that monies. You have to accept it. It doesn't have to be in our purchasing procurement process for that to happen.
That's correct. Madam Clerk, could I have a roll call, please?
Commissioner Skolnick.
Now, we're voting, just so I make sure I know what I'm doing here.
We're voting to remove prevailing wage from our policy.
Yes.
Commissioner Snyder.
Yes.
Commissioner Wilkins.
No.
Vice Chair Foster.
Yes.
Commissioner Hovey Wright.
No.
Commissioner Layering.
Yes.
Commissioner Mahoney.
No.
Commissioner Hughes.
Yes.
No.
Did they not call you?
That's what I was coming to.
We were trying to figure out who it was.
Yeah, and you're no. So it's
So it's on
5
record.
yes, and 4 no.
And that motion carries. Is there any other old business to come before this committee? Seeing none, any new business to come before this committee? Seeing none, now we have time set aside for public comment. Do we have anybody that would like to have public comment? And if you have a sheet filled out, would you just set it on the podium for us, please? And limit your, please state your name and address, and limit your comments to 2 minutes or less.
Mary Valentine, 301 Alway Road, Norton Shores. I just wanted to make some comments about another rash decision that this board made related to family planning services in Muskegon County. Under Public Health Act 368 of 1978, the local health department, under the supervision of the Michigan Department of Health and Human Services, quote, shall provide family planning services to a medically indigent individual upon the individual's request, unquote. This is consistent with Essential Public Health Service number 7 of the 10 Essential Public Health Services. So number 7 of the 10 is that, quote, link people to needed personal health services and assure the provision of care when otherwise unavailable, unquote. An assessment of compliance with this law is a part of the state accreditation process of our county health department. This accreditation takes place every 3 years. The last accreditation took place in June of 2018. Citizens have already been in touch with the state and will notify the appropriate officials the moment the Muskegon County Health Department is out of compliance with their accreditation standards by not fulfilling their obligation to ensure family planning services remain available without interruption. The county commissioners are the governing entity for Public Health Muskegon County. The National Association for Local Boards of Public Health has established national public health performance standards that our county commissioners should be held to. Their public health governing entity model for Standard 7 expects commissioners to advocate for all citizens in the county, not just those served by their own district. They are also expected to encourage linkages between the public health department and other public health systems, stakeholder organizations to reduce barriers to health care. The link with Planned Parenthood Service is an example of such a linkage. Thank you.
Thank you. Would you state your name and address and keep your comments to 2 minutes or less?
Yes, thank you. Donna Pennington, 1418 Lakeshore Drive, Muskegon. In evicting Planned Parenthood, our public health leadership did not follow the core competencies for public health professionals. The following core competencies applying to senior management and executive level, referred to as Tier 3 competencies in the list of core competencies, were not followed with reference to the decision to evict Planned Parenthood. These core competencies are supported by the American Public Health Association, the National Association of City and County Health Officials, the National Association of Local Boards of Health, and the Centers for Disease Control and Prevention, and at least 16 other groups. The first of these core competencies is that our health officer is to use analytic and assessment skills to integrate findings from quantitative and qualitative data into organizational plans and operations. C11, analytic assessment skills to assess assets and resources that can be used for improving the health of a community. C12 determines community health status and factors influencing health in a community. For example, the quality, availability, accessibility, and the use of family planning services. C14, analytic assessment skills, makes evidence-based decisions in planning population health services. C15, analytic assessment skills, advocates for the use of evidence in decision-making that affects the health of a community. In this case, 2 of the county commissioners did request such evidence and data before having to vote on the Planned Parenthood decision. Sorry.
Good afternoon. I'm Terry Hampel, 6171 Duck Lake Road, Fruitland Township. We are here today not only to educate you board members, because we know that you know all these things, but to put this on record so that the public knows that we are constantly aware of the services that are provided by Planned Parenthood through the Public Health Department. Under the core competencies that are expected of the Health Department is also C15, analytical assessment skills, advocates for the use of evidence in decision-making that affects the health of a community. In this case, 2 of the county commissioners did request such evidence before having to vote on the Planned Parenthood eviction. Another competency, 2C7, policy development and program planning skills. This determines the fiscal, social, political, legal, and geographic feasibility and implications of policies, programs, and services. Were these factors considered with reference to the Planned Parenthood eviction? C5, actually 3C5, communication skills. This conveys data and information to professionals and the public using a variety of approaches. A question for you, has the public or community professionals, have they received any communication regarding family planning or reproductive health care options since the eviction decision? 4C6, cultural competency skills. This evaluates the effects of policies, programs, and services on different populations in a community. In particular, was the impact of this decision on low-income teens and young women adequately considered? 5C4, community dimensions of practice skills. This establishes relationships to improve health in a community. For example, partnerships with organizations serving the same population. 5C10, and I understand my time is almost up. Community decisions or dimensions of practice skills. This defends policies, programs, and resources. Thank you.
Hello. I'm Tony Way. I live at 3744 Arbor Way Drive, Muskegon, 49441. And I've forgotten where we left off.
5C10.
Thank you. 5C10, community dimensions of practice skills. This defends policies, programs, and resources that improve health in a community. Family planning services and reproductive health care are among those.
that improve the health in a community and should be safeguarded. 6C5, public health science skills, synthesizes evidence, research findings, case reports, and community surveys from print and electronic to support decision-making. 7C10, financial planning and management skills. This ensures the use of financial analysis methods in making decisions about policies, programs, and services, such as cost effectiveness, cost benefit, cost utility analysis, and return on investment. 8C3, leadership and systems thinking skills, creates opportunities for organizations to work together or individually to improve the health of a community. Many potentially restrictive family planning policies exist in Muskegon County, but their impact on our residents has not been measured. There are a number of policies that create significant barriers to the availability. Law limiting ability to dispense birth control in a public school, teen health centers.
Thank you very much.
Thank you. Hi, my name is Mary Hendon. I live at 749 Hendrick Road, Muskegon, Michigan, 49441. This is to continue. There are a number of policies that create significant barriers to the availability of family planning in Muskegon County. Law limiting ability to dispense birth control in a public school. Teen health centers cannot prescribe birth control or distribute condoms. Number 2, ethical and religious directives for Catholic healthcare institutions. Muskegon County has a sole acute care hospital. Studies have shown that reductions in tubal ligations and administration of Depo-Provera have occurred after mergers, resulting in hospitals that are converted from secular to Catholic. Next, religious refusal laws. The United States provides vast protections for the rights of healthcare providers to deny services based on their religious beliefs. Both the Muskegon County Fetal Infant Mortality Review Board and the Muskegon County Family Planning Task Force extensively documented barriers to family planning, some of which involved religious refusals. Indirect indicators for access family planning provide further proof of existing barriers to family planning services in Muskegon County, including high rates of teen pregnancy. In Muskegon County in 2017, 7.2% of births were to teens, compared to 4.8% for the state of Michigan. High rates of Black infant mortality. Infant mortality is the most sensitive indicator of the health of a community. Due to systemic racism in the United States and implicit bias among health and human service workers, the racial disparity or difference between white and Black infant mortality serves as an indicator of inequality in a community. Black infants of Muskegon County are 5.5 times more likely than white infants to die before their first birthday. The Black infant mortality rate for the city of Muskegon is the highest of any city in Michigan.
Thank you. Jane Horton, 1611 Simonelli Road, Laketon Township. This data is significant because unintended and closely spaced pregnancies lead to poor health among birthing people and their infants. The racial disparities in infant mortality suggest that unequal access to family planning contributes to this injustice. High rates of poverty. In 2017, 23.4% of children in Muskegon County lived in high poverty neighborhoods, compared to 15% of children statewide, according to the Annie E. Casey Foundation. Unintended pregnancies are correlated with poverty for childbearing people and their families. High rates of child abuse. Muskegon County has a rate of 31.6 confirmed cases of child abuse per 1,000 children ages 0 to 17, compared with 18.5 in the state of Michigan overall, Annie E. Casey Foundation. Unintended pregnancies may be an important risk factor for child abuse and maltreatment among all parents. Better understanding of gaps in existing family planning services can help public health
Muskegon County meet the Healthy People 2020 family planning objectives and address quality in existing services. Proposals regarding accountability to the citizens of Muskegon County for access to family planning. In light of the inadvertently considered and short-sighted action on the part of Public Health Muskegon County's leadership and the Muskegon County Board of Commissioners, we request the following. 1. Accountability from Public Health Muskegon County. A copy of the last performance evaluation for the health officer. The next evaluation should reflect the lack of compliance with core competencies for public health professionals regarding...
Thank you very much.
Margot Haynes, 5150 Brookwood Circle, Montague, Michigan. I'm going to make one correction in what she read in light of the inadequately considered and short-sighted action on the part of Public Health Muskegon County's leadership. The accountability, we would like the evaluation for the health officer, a copy of the last performance made available, and the next evaluation reflect the lack of compliance with core competencies for public health professionals regarding the endangerment of family planning, an essential public service. Accountability from the Muskegon County Commissioners, that you agree to hold yourself to the national public health performance standards for public health governing entities. 3. Mitigate damage from failing to meet public health performance standards and core competencies. Allow sufficient transition time and designate funds to support Planned Parenthood in relocating in order to minimize the gap in Title X services to community members. 4. Make information readily available to the public regarding alternatives to Planned Parenthood services. And number 5, assess quality of current family planning services. Produce copies of the pre-materials for family planning sent to the state for the most recent accreditation cycle for Public Health Muskegon County. Direct Public Health Muskegon County to conduct a comprehensive family planning needs assessment in our community. And I submit references to the city clerk along with a copy of this. County clerk, sorry.
Thank you.
Hi, my name is Anna Olson, 3414 Verna Avenue, Muskegon. I'm here today in front of you to point the county stands on diversity, equality, and inclusion. I am a Muskegon County resident since 2012, and I have happened to witness a lot of changes that are going on, but unfortunately not very favorable for my community. I am a business owner, and then I also part of a nonprofit called Latinos Working for the Future, and then so we have made some meetings, and we want to know what Muskegon County stands in diversity, equality, and inclusion for all. Our population is 8,261 people as 2010. And then so I was surprised to find out that the availability and materials from the cities, counties, and the townships is not to be existed. There is a lot of resources if you're in the health field, if you're going to doctors, or if you want to know about vaccinations and things like that. But when it comes to just simple city ordinance, things that people need to know in order to comply with the city they are not. And that makes me sad. I also, before my time runs out, I wanted to invite you to the Diversity, Equality, and Inclusion in Ottawa County. This is going to be happening on November 15th in the Holland Civic Center, and that's the signage used for government, for you guys to just learn how to plan and correct the bias in the county. It's very important. Times are changing. Change with us. We need it. We need you guys.
Thank you.
Thank you, Anna.
Hi, good afternoon, Commissioners. I'm Mike Kemp. I live in North Muskegon, and looks like I have two subjects here, but the first one was the prevailing wage. Doing a little research, for, I'm sure you have all read it, but it says on June 6, 2018, Michigan's prevailing wages on state projects law 8 Act 166 of 1965 was repealed as a result of legislative initiative. The repeal was given immediate effect. Wage and hour, therefore, will no longer issue prevailing wage rates, and updates to surveys will not be made. Any survey or other prevailing wage information that filed with wage and hour in the future will be returned to the sender. I guess a rhetorical question here is, if we keep it in Muskegon County, who's going to determine the prevailing wage? There's nowhere to go unless you do it yourselves, and I don't think that's appropriate. Second issue, our sisters from the Planned Parenthood have taken up some more time today. My retraction is simple. If they're going to stay past 90 days, they ought to be charged $100 a day for every day they're over, or something of that nature. But I would suggest that they not be able to do that. And again, everything that they read would give you the idea that you've kicked them out of the county. They can do all of those things, and our Kathy Moore is responsible, and you've all supported her, and there's no reason to backstab her.
Hello, my name is Sandra Kemp, 713 Fowler Street. And esteemed commissioners, I'm really grateful for the opportunity you give us to say something about the things that we're discussing. You voted twice to remove Planned Parenthood from the Health Department building. So I want you to make no mistake, your constituents will support you on that vote. We, the taxpayers, do not want any private entity to use that space that rightfully belongs to the county health department, and it's very much needed by that department. As my husband mentioned, Planned Parenthood is not being evicted from the county. They're simply being evicted from county property. And so I support you in that vote. Thank you.
Thank you. Mr. Cross.
Yes, Tim Cross, 6450 Zeno Road in Whitehall. I guess just being here, and we went through a 5-hour county commission meeting, and nobody wants to rehash all of that. But I think just to be reminded, just as the person before me said, nobody's evicting Planned Parenthood out of Muskegon County. They have millions of dollars in their coffers in the state organization. They can find another facility that they would like to get into if they want to. And I don't think there's going to be any break. That we found out in that meeting a month or so ago that there are plenty of organizations and capable places in terms of family planning. It may not be their model of family planning, but there is things there. But I also thought, some of the statistics that they quoted, it's like, aren't they supposed to be part of the solution? And if all the statistics are bad, they don't seem to be doing too good. If they're supposed to be part of the group that takes care of these things, if our stats are that bad, they might have to take some blame for that. So they can go anyplace else in the county. There are plenty of facilities available. They can go there. I want to continue to say we support Kathy Moore and her decision, and I really disliked any attack on Kathy Moore as to her competence. I don't think that's appropriate. I think she has done a good job, and she has basically just held to a contract that was signed between the county and Planned Parenthood. And Planned Parenthood, either one of them could give a 60-day notice. It was in the contract. You've been generous enough to give them an extra 30 days, and this should not be continuing to come up before this commission. Thank you.
Thank you.
Hello, Tammy Barnhart. I live in Fruitport. First, I'd like to say I thank you for your vote today on prevailing wage. I support that. And I'd also like to thank you on your previous vote about Planned Parenthood. I also want to say I support you on that, and I thank you. Next, I'd like to say that the Drain Commissioner. The Drain Commissioner held a board of determination on May 15th. And at that time, she took 34 of the 130 county drains and she redistricted them, which means she subtracted some lands and added some lands. Based on my review of those 34 that she just did, what she did was she subtracted lands, like let's say there was 10 acres of land that belonged to one person, and what it turned out to be was you eliminated this one person, but you included an area of 10 acres that had 10 people. And this is all just the advantage of you can charge one person 10 grand or you can charge 10 people 1,000. Who's gonna scream the hardest? So anyhow, I went to this public meeting on this day, and before I even said one word, she was talking to somebody else. She turned around to me and said, "You don't belong here, you need to leave." And I said, "I have every right to be here." She said, "If you don't leave, I'm gonna call the police on you." I said, "Oh my God, I just got here, and all I'm gonna do is I'm gonna tell people the honest truth of what happened to us and what my assessment is, and I'm going to inform them about what questions that they need to ask." Because the Drain Commissioner, the people were there to find out their apportionments, which is the percent that they're gonna owe on a project. But they weren't given that information there. All they were given was the amounts that they had to pay. So that was wrong. So I stayed there and I informed the people, and the people got more educated and they thanked me. Anyways, the next day I have this email from the Drain Commissioner, which was unsolicited. It was provoking, intimidating, harassing, and included lies. And she did this all from a government computer, on a government email, on government time, to my private email.
Thank you.
I'd like to submit this as evidence for the record, please.
Thank you.
Thank you. And just pass around if anybody wants.
My name is Sandy J. Glore, and I live at 569A in McLaren Street. And I am here to support Kathy and to say that you have voted on this twice now, and that we need to not give them any more time for Planned Parenthood to get out of the county building. Kathy is very well equipped to do what needs to be done in our county. Thank you.
Thank you.
Hi, Faith Grusbeck, 816 Washington Avenue, Muskegon. I'd just like to speak on the Planned Parenthood issue. A lot of people are saying that it is a done deal. It is true that providing these services is required by public health under state law, and if these services are not available, which is specifically the Title X services, there are going to be issues. This is all collected at the state level every 3 years so that the county public health department can get their accreditation. If they are out of compliance, there will be consequences from the state and from the community. So this is not a small matter, and it won't just go away. It's also not a new matter. For some reason, other aspects of public health, our county really excels on in terms of immunization rates, other things, but for some reason, the issue of family planning is a real problem when it comes to leadership for people standing up to support these essential public health services. It doesn't really make sense to me because family planning is the foundation of health for the entire community. The health of our community starts before we're conceived. So that means we want the people having babies to be in the best health they can possibly be when they decide to do that at the best time for them. That's what our entire population's health is based on. So we need to be taking this much more seriously. It is not just a fact that Planned Parenthood can uproot and go anywhere. They need to go where the need is greatest, and we haven't even talked about that. There's been no discussion about where is the ideal location. Is it best for them to be in the public health department, or is there somewhere where they can serve the community even better? We lack that data. We have no idea. So I would like people to think about this, and it's not going to go away. It's kind of just a really bad problem that's getting worse. Thank you.
Thank you.
Anna Derwin, 1391 West Laketon Avenue. First of all, thank you for your vote on prevailing wage. Truly appreciate that. Also, Planned Parenthood. We aren't telling them they can't do their services. They can go elsewhere and do it. A contract was entered in between Planned Parenthood and the health department. And it states in that contract that either one can break that contract. Well, that's happened. We went over to the health department. I don't know if any of you have gone over there and actually seen the conditions, but we did. I was appalled at the space that our nurses have to work. And then I saw the spaces where Planned Parenthood works. 5 examining rooms, 5 examining tables, 5 sinks. I mean, nice sinks. A lab area with a sink. Our people in Muskegon County, they need to have services as well. And again, we're not telling Planned Parenthood they can't do their services. They just need to take the time and the effort and get someone who can help them and find a place where they can do their services if that indeed is their intent. So I agree with Kathy Moore. I support her, and I ask that you stick with your vote. You've given them 90 days to move. They're very generous. So please, let's just get this over with and do what's right for the community and let our people be serviced in the way that they should be.
Thank you very much.
Thank you.
I'm Billy Pickle-Sammers, 3641 John Street. And of course, I've been here enough to know I support Kathy Moore. And I've been told that all of this lawyer and so forth written up material that is being presented was not for the reason to try to change your minds, but was just so you know what they do. And to me, it looks like they're very well being organized to try to get you to change your mind on this and let them perhaps stay where they are or whatever. But there's a lot of things like the HIPAA. There could be a problem for the county if someone wanted to present that because of what is going on. And I'm a person that we all want God's blessing. I don't doubt that a bit. How can we expect it if we don't really seek in our hearts to do what is right before Him and what His Word teaches us?
Thank you. Hi, I'm Sandy Arnouts, and I live at 3461 South Carr Road in Fruitport. And I'm here to also to support Kathy with her decision, and I'd like to see her to be able to do the job that she won her office for. And I think that it's time that this is over with, and so she can do what she needs to do and for the right reasons. And you guys have taken a lot of time to decide, and let's move forward. Thank you.
Paul Second, 4722 Far Road, Fruitport, Michigan. I'm here looking for support for Senate Bill 37, which is the repeal of the ban on feeding and baiting of deer. Muskegon County residents were, Muskegon County was put in the chronic wasting disease. It shouldn't have been done. The facts haven't proved it out. Senator Vanderwall from Manistee has introduced this bill, and it needs a lot of support. And I think Muskegon County farmers, Muskegon County hunters, Muskegon County landowners have been shortchanged on this, and I expect my county commissioners to check it out, and I would be glad to come to a work session, anything that needs to be done to enlighten you on this. And I testified last week in Lansing at a hearing for the National Resources Commission, and it's a 50-50 toss-up right now whether it'll pass or not. but I really feel that we've went from 1.2 million hunters down to 350,000 hunters, and with this change coming this year, it's going to drop considerably more. And I don't want to take up too much of the public's time here, but I'm just asking that maybe afterwards a few commissioners come talk to me and tell me what's the best way to go for asking for a resolution in support of this bill. Thank you very much.
Thank you. I'm Kathy Moore, Public Health Director. I just want to comment that I understand people have different opinions, and there is some confusion and mix-up in some of the terminology. So there are the Michigan Public Health Code. This board is required to have, of course, a local public health department, not a Planned Parenthood organization. And my initial proposal, actually had nothing to do with Planned Parenthood. It was actually to reclaim the space for our nurses. So it wasn't intended to be adversary. But I did want to just highlight that the central local public health services does not include family planning. And that's not saying that they're not important. They don't include nutrition education. So those are two required by public health, where we just assure that it's being done. We don't have to deliver it directly. By definition of public health, our focus is on population, not necessarily individual services. But you could just Google essential local public health services for Michigan, and they are food protection, so doing the inspections in the restaurants, private groundwater and public water supply, on-site sewage disposal management, hearing screening, vision screening, sexually transmitted disease control and prevention, immunizations, and infectious disease control. Not family planning. But I don't want to say that because I don't want to pretend it's not important. It is important, but it's not an essential local public health service. Thank you. Is there any more public comment? Seeing none, and we have a motion in support, and we are now in.